to all the participants, viewers of Rehabilitation Science Group today. We have with us Dr. Aparna Kondapalli. She is uh, she will be talking on exercise prescription for type 2 diabetic population. Ma'am, we would like your consent uh, for the video to be live on YouTube.
Yeah, sir, sure. My pleasure.
Yeah, I would like to introduce the speaker for today, Dr. Aparna Kondapalli. She has 19 years of academic experience and more than 20 years of clinical experience. Presently, she is a senior faculty at Durgabai Deshmukh College of Physiotherapy and is also simultaneously the head of the Department of Sports Medicine. She is member board of studies at KNR University of Health Science for both undergraduate and postgraduate studies. She is also a member of admissions for paramedical and allied health sciences. To her credit, she also has been a resource person for various workshops in India. We welcome you, ma'am, for Rehabilitation Science Group today. You may please continue.
Thank you. Thank you so much, sir. That was really a nice introduction. Thank you so much for introducing me. And thank you, the Rehabilitation Science Group, for giving me this chance to present myself before you. And today I would like to talk about the type 2 diabetes and the exercise prescription for diabetic population, especially type 2. So, as all of us know, diabetes mellitus is a metabolic disorder characterized by hyperglycemia. Hyperglycemia means increase in the blood sugar levels, resulting from a deficit in insulin secretion or insulin action, or both, which causes hyperglycemia, disturbance of carbohydrate, fat, and protein metabolism, and a constellation of chronic complications. So there are three types of diabetes. One is type 1 diabetes, type 2 diabetes, and the gestational diabetes mellitus. Type 1 is the deficiency in the production of the insulin, and type 2 diabetes is because of the insulin resistance, there is an increase in the blood sugar levels, that is type 2. So sometimes there may be associated decrease in the insulin production as well as insulin resistance in type 2. Whereas gestational diabetes is the during pregnancy, there is an increase in the blood sugar levels. Coming to type 2 diabetes, as I told you, there is insulin resistance with insulin deficiency or deficiency of insulin with resistance to insulin action. Either may come first or the second. In type 1 diabetes, if you see, these people want to exercise but they shouldn't, because here the production of insulin is inhibited. They have to take insulin injections injected. That is, so it contributes only 5 to 10% of the population, whereas type 2 diabetes is 90 to 95% of the diabetes, or diabetics are mainly type 2. They won't exercise. They have to exercise, but they don't exercise. So that is the difference. Next, gestational diabetes is any degree of glucose intolerance is first detected during pregnancy. Almost 4% of all the pregnancies are complicated because of this gestational diabetes. And we have to go with the glucose, diabetic screening for the mother. So first 50 grams of oral glucose load, they do glucose loading 50 grams, then check 1 hour post load plasma glucose. If the plasma glucose levels are greater than 140 mg per dl, then check 3 hours glucose tolerance test. So if they are elevated, that means it may lead to it may be because of the gestational diabetes mellitus. So what are the normal acceptable blood values given by National Diabetic Educational Program? These are the normative values. Fasting blood sugar should be between 80 to 120 mg per dl. Postprandial should be between 140 to 170 mg per dl. HbA1c value should be less than 7. Total cholesterol should be less than 200 mg per dl. HDL, that is the good cholesterol, should be greater than 40 for men and greater than 50 for women. Bad cholesterol, that is the LDL, should be less than 100. Triglycerides less than 150 mg per dl. Blood pressure less than 130 per 80, 130 by 80 mmHg. And the body mass index should be less than 27. So these are the acceptable values where that person is considered a non-diabetic. In 2010, diagnosis, according to diagnosis of diabetes, and who are more prone for increased risk of diabetes. So we have seen what are the normal values. Once again, let us have a quick glance. Normal fasting plasma glucose should be less than one, for them less than 100 mg per dl. And if you see the impaired fasting glucose or the impaired glucose tolerance, if you see greater than 100 to 125 mg per dl, that means they are glucose intolerant. In diabetes, if the fasting plasma glucose levels are greater than 126 mg per dl, they are called diabetic population. 2 hour post glucose postprandial should be less than, if it is less than 140 mg per dl, they are considered normal. Whereas IGT, 2 hours post prandial glucose greater than 140 to 199 mg per dl, that means impaired glucose tolerance. Whereas in diabetes, 2 hours PG greater than 200 mg is considered as diabetic. HbA1c 5.7% to 6.4 is a pre-diabetic, whereas greater than 6.5% we consider them as the diabetic population. This is given as per the American Diabetic Association in 2010. If you see the prevalence, see the left side graph, China is the most, the country which is having the highest number of diabetic patients. Next to China, India is the second most, is the second, having the second, it's the highest country having the most number of diabetic patients. This is as of statistics given in 2019, where age of 20 to 79 years old people, if you see, most of them are, it is becoming a pandemic now. Diabetes is becoming a pandemic, 21st century pandemic. And we don't know, by 2040 it may still rise. Whereas if you see the continued growth in the number of people in diabetes, you see it has been escalating from 1980 to 2040. It has been escalating from low to high. So we have to be very cautious about this escalating problem, because diabetes leads to many associated risk factors in later life. So if you see in India, if you see the different states, the red represents the men and the blue one is the women. This Y is the prevalence in percentage, and this x-axis represent different states. If you see, Assam is having the low, whereas Trivandrum stands first in diabetes in India. Next is the Hyderabad, next Bangalore, next Lucknow, Delhi, Coimbatore, Pune, Nagpur, and Assam. So if you saw, Trivandrum is having more risk for is more in diabetic population, and Assam stands the least. But if you take the overall, men are 8% and women are 9%. They are having more risk in diabetes. So why especially India is standing second, having the highest number of diabetes, and why is it so escalating? One is, normally, if you see the Indian, ancient Indian phenotype, our body composition itself, if you see, our BMI values are different. One thing, our body stature is different, and we have Indians are having greater waist circumference, despite we are having the normal body mass index. We cannot categorize Okay, if I have a normal BMI also, why am I more prone for diabetes? So waist circumference, if it waist circumference means the adipose tissue around the waist, that is more prone for getting metabolic disorders like diabetes, especially the obesity, especially the central obesity, that is the waist circumference. And the increased insulin resistance and greater abdominal adiposities. Next, lower adiponectin values. Adiponectin is released. It is a biomarker. Adiponectin is a cytokine released from the adipose tissue. This adiponectin values, if there is, it is high in population, if it is high in in an individual, they are at low risk for getting metabolic disorders. If you see, but in diabetes or obesity, these adiponectin values are falling less. They're coming down. That is why they're more prone for heart diseases or renal failures or stroke, or they have so many complications that we will deal in the later slides. And people having higher CRP levels also starts raising in diabetes. So these are the main things that we have to see, focus in diabetes. So one is the body composition, and check out the abdominal adiposity values. Then check out if there is any increase in the insulin resistance. That means check out the whether we have diabetes or hypertension. And lower adiponectin values, blood values, you can get those adiponectin values and CRP by taking the blood samples. So these that is the reason why Indians are more prone for getting diabetes. The risk factors for diabetes: one is age above 40 years, inactive lifestyle, high blood pressure, gestational diabetes, impaired glucose tolerance, abnormal blood lipid values, and obesity, that is BMI greater than 23 kg per meter square, and family history. So these are the main risk factors where it leads to diabetes. Complications, if you see, you have the acute complications and the chronic complications. Acute complications is hypoglycemia, that is decrease in the blood sugar levels. Diabetic ketoacidosis, these people, if you see, they are more prone for ketoacidosis, means incomplete breakdown of fat leads to ketoacidosis. They get ketosis. If you see ketone body, that is why they examine ketone bodies in the urine. So if diabetic ketoacidosis, non-ketotic hyperosmolar diabetic syndrome, or they go into coma, or lactic acidosis. Where if you see the chronic complications, microvascular nephropathies, retinopathy, and neuropathies. Macrovascular is coronary artery disease or cerebrovascular disease or the peripheral arterial disease. So if you see, almost diabetes is affecting almost all the organs of the body, right? Even the psychological aspect also it is being affecting. See here how the pathophysiology is there. So once whatever food we take, it is getting converted into glucose, and once the blood glucose levels rises, then the pancreas will release the beta cells. This stimulates the beta cells of the pancreas, which releases insulin. This insulin is responsible for glucose uptake by the muscle, glucose production or storing of glucose in the liver in the form of glycogen, or breakdown of fatty acids. So that is the normal function of the insulin, which promotes glucose uptake by the cells. What happens in case of diabetes? This beta cells undergoes dysfunction, leading to release of the pro-inflammatory cytokines. These are the pro-inflammatory cytokines. They are the biomarkers released especially from the fat cells, white adipose tissue. If the person is having greater amount of white adipose tissue, that is why I have mentioned previously, The white adipose tissue is mainly concentrated in the abdominal adiposity, in abdominal area, mostly in the abdominal. That is why central adiposity is more dangerous when compared to other adiposities. We have different pear-shaped and apple-shaped. Apple-shaped is more dangerous because the central adiposity is more, because this is where there is release of more number of pro-inflammatory cytokines. When these pro-inflammatory cytokines, what are they? The IL-1, interleukin 1, interleukin 6, tumor necrosis factors, these are all the different pro-inflammatory cytokines, will cause a decrease in the insulin sensitivity, will cause altered insulin sensitivity, means increase in the insulin resistance. Once the insulin resistance increases, then the glutamins means the glucose transporters, the IGF factor, the insulin receptors, they start decreasing in number, leading to insulin resistance. This insulin resistance will cause altered metabolism, or will not allow the glucose transport into the cell, leading to various metabolic disorders like you have a fatty liver diseases or type 2 diabetes or chronic kidney disease, then heart diseases. So many, it leads to so many problems. So this is the main thing, that is, so the main pathology behind is because of these pro-inflammatory cytokines, that is altering the metabolism of the body. So just let us have a quick glance what is happening in diabetes. I'll just show you a small video. So this is in type 2 diabetes. Whatever food we take, it is ultimately converted into glucose, sugars. Whether you take carbohydrates, lipids, or fats, it is converted into glucose. And this glucose, once you enter it into the digestive system, so here it entering into the digestive system, be it the carbohydrates or fats or proteins, they are broken down into glucose or sugars. Okay, so this glucose have to enter into the cell for its function. Okay, so now the glucose is the fuel for the cell. So what is happening? So once the blood sugar levels increases, the beta cells of the pancreas releases insulin. It is releasing insulin, which the released insulin is accepted by the insulin receptors. Once this insulin acts is receptors receive that insulin, it promotes the glucose uptake into the cell. Here this insulin will facilitate the glutamins to open this channel, and so that thereafter the glucose enters into the cell. So what is happening in diabetes, type 2 diabetes? Because of the altered increase in the insulin resistance, it is not allowing the cell's uptake of glucose. There is no glucose entry into the cell because of the decrease in the glutamins and also increase in the insulin resistance. And even if the pancreas does not produce enough insulin, there is no enough amount of oxygen or the glucose that is entering into the cell. So leading to diabetes, increase in the blood sugar levels. So what are the symptoms? Frequent urination, thirst, weakness, drowsiness, blurred vision. So these are the symptoms of the type 2 diabetes. So 1 in 4 people are unaware that they have type 2 diabetes. So remember the symptoms what we have dealt. So symptoms are frequent urination, thirst, weakness, drowsiness, and blurred vision. If you notice any of the symptoms, that means you first go and have to check the blood sugar levels. So once there is an increase in the blood sugar levels, this diabetes is attacked. It causes damage to the blood vessels. Once, because of the increase in the blood glucose. Once if there is a damage of the micro blood vessels, it leads to vision problems, nerve damage, and the kidney renal problems. If there is a damage to the large blood vessels, then it leads to coronary artery disease, stroke, or the poor blood circulation. So the main risk factors are overweight, sedentary lifestyle, lack of exercise, and the family history. These people are more risk for having type 2 diabetes. So what are the, even some medications may increase the risk of type 2 diabetes. What are they? They are the corticosteroids, diuretics, and some psychological drugs used for treating the psychosis and all, and some drugs to treat HIV. So on the whole, type 2 diabetes is a metabolic disorder where there is an increase in the blood sugar levels. So early diagnosis is very much important. Don't wait for all the symptoms. Every year you have to go after the age of 30 years, try to just go for the HbA1c test, okay? And if the person is having more than age of 30 to 40 years, excuse me. Sorry, 1 minute. Slide. 1 minute, sir. I'm sorry. 1 minute. My this thing is
No
stuck.
problem, ma'am. It's okay.
Slideshow, please. Slideshow. Slideshow. ఎక్కడికి వెళ్తావు? Sir, is it okay?
It's okay, ma'am. It's okay now.
Yeah, thank you, sir. So what are the phases of the insulin release? So once the food is consumed in the non-diabetic population, if you see this, the green one is the non-diabetic, normal individuals who do not have diabetes. The red one is the people diagnosed with early type 2 diabetes, and the blue one represents the late 2 diabetic population. See, once the food is consumed, see the phase how the insulin is released. In the normal population, there is a rapid increase in the insulin release, whereas the type 2 whereas in the second phase of early type 2 people, it is little inhibited, whereas in the chronic diabetic population, late type 2 diabetes, see there is no release of insulin, where they have to later on they have to depend on the where they have to get the insulin injected. So what is the treatment of this type 2 diabetes? So mainly there three, we have to depend, these diabetic people have to depend on three. One is diet, exercise, and medications. Have all the three have to go parallel to each other. Either one shouldn't be missed. So we have to improve through diet, exercise regularly, and take medications as prescribed by the dietitian. So physical activity is like a magic for type 2 diabetes. So before going with the exercises, the diabetic person have to go with a thorough examination evaluated by a physical therapist, along with mainly has to get clearance from the physician. He should be assessed for any cardiovascular disease, peripheral vascular disease, any retinopathy, nephropathy, autonomic neuropathy, or peripheral neuropathy. Because we have discussed in diabetic people, they are more prone for major risk factors. We have the microvascular diseases as well as the macrovascular diseases. So that is why we have to alter the exercise prescription depending on the individual. Though all are diabetic, it is individualized program. So thorough examination or pre-exercise evaluation is must if the person is having diabetes, and find out whether is they are having any associated risk factors. Based on that, we have to design the exercise program. So first check for the blood glucose levels before going to exercise. If the glucose levels are less than 100 mg per dl prior to exercise, then take additional amount of carbohydrates, at least 20 to 30 grams of carbohydrate before going to exercise. If blood glucose levels are between 100 to 250 mg per dl, then okay, the person can go for activity, can go with the exercise. If the blood glucose levels are between 251 to 300 mg per dl with no ketones in the urine, still he can go with exercise. If blood glucose levels are greater than 250 mg per dl but having ketones in the urine, then do not exercise. If blood glucose levels are greater than 300 mg per dl with no ketones, still he can go with exercise but with caution. So always have avoid high intensity exercises if the glucose levels are greater than 300 but still no ketones. So ketones are very dangerous when the person have to get evaluated before going a exercise program. So what are the different exercises we have? As all of us know, we have aerobic exercises, resisted exercises, and flexibility exercises. Aerobic exercises are nothing but low intensity exercises done for a prolonged period or prolonged duration. And whereas resisted exercises are high intensity exercises, but the duration of the exercises is less, and flexibility or stretching exercises. So examples of aerobic are you have walking, jogging, running, cycling, or swimming, etc. And whereas resisted exercises, we can use weight training or circuit training or free weights or theraband training or dance, or these all comes under resisted training, and the general flexibility exercises. So how much amount of physical activity is needed to promote health, at least to bring a change in the diabetic? So how much amount? So according to American College of Sports Medicine in 2000, and also according to the Center for Disease Control in 1996, so they have given guidelines that at least moderate intensity of physical activity with energy expenditure of 3 to 6 mets. Mets means metabolic equivalents greater than 30 minutes per day, at least for 5 days per week. The That means approximately 150 minutes per week is necessary to promote health in this diabetic population. So 3 to 6 mets means a moderate intensity exercise. Okay, so that means at least we have to spend more than 1000 kilocalories per week to have health benefits associated with exercise. So these are the mets. If you see, we said 3 to 6. So 3 to 6 mets means it comes under moderate intense activities, which are cycling or walking or swimming. This all comes under moderate intensity exercise. Okay. So what are these are the recommendations given for type 2 diabetes population according to American Diabetic Association and 2006. So first, patients with type 2 diabetes have to be evaluated before going for any exercise program, and and see that the absolute contraindications are there are no contraindications before going to exercise. Check out all the risk factors, and also check out if there is any ketone bodies in the urine, and if no, then okay, then these are the recommendations. So greater than 150 minutes per week with moderate intensity, that is with 50 to 70% of maximum heart rate. So maximum heart rate is 220 minus age. Suppose 220 minus 8, suppose if you think that your age is 20 years, so 220 minus 20 means 200. So in that 50 to 70% is the initial intensity that the person have to do the exercise. So greater than 150 minutes per week, moderate intensity with 50 to 70% of the maximum heart rate, aerobic activity, and or it can be and or greater than 90 minutes per week vigorous activity. If check, the first thing is check the age of the patient and check out if the is more prone for risk factors, then go only with the light intensity. So greater than 90 minutes per week vigorous activity, that is greater than 70% maximum heart rate, aerobic activity, or resisted exercise 3 times per week targeting all the major muscle groups. So distribute the physical activity over 3 days per week with no more than 2 consecutive days without physical activity. That means you shouldn't get at least 2 days break in between activity. At least you have to go alternatively. No, or all the days per week he has to undergo activity. So let us have a quick glance with this exercise recommendations. These are the new recommendations given by the American College of Sports Medicine for type 2 diabetic population. Frequency, you have two aerobic activities as well as the resisted activities. Either you can choose. Okay, some studies are telling both can be given. Some are telling only aerobic is better, some are telling resisted exercises are better. So if it is you're choosing aerobic activities, then the frequency should be 3 to 7 days per week. Intensity moderate to vigorous, mainly low intensity. Always start with low intensity, then start increasing the intensity based on the metabolic capacity of an individual. Time should be at least 150 minutes per week. And target is large muscle group activities such as walking, cycling, dancing, and aerobic activities. If you choose resisted exercises, the frequency should be at least 2 or 3 days per week. Start with low to moderate, then progress to high intensity activities. And time is 18 to 15 repetitions per set. Like that, 8 to 10 different exercises, likewise 1 to 3 set per exercise. So we choose resisted machines or free weights, or choose any type of resisted exercises that you have. Okay, it can be interval training, it can be a circuit training, it can be a circuit interval training, choose accordingly. So these are the recommendations given by ACSM. But prior to going any type of activity, first include warm up, and after for a cool down following exercise. So before exercise, include 5 minutes warm up, then check blood glucose levels. After exercise, also include 5 minutes cool down exercises, and then the check post blood sugar levels after the exercise. Other important lifestyle changes that you have to suggest to this diabetic population is exercise 150 minutes per week with moderate intensity aerobic physical activities for at least 3 days per week, and no gap of 2 days in between. Uh, Same recommendations for given with impaired fasting glucose or pre-diabetic people also, same thing. And sometimes stress test may be also be needed to rule out any cardiac complications. And consistent exercise for 8 weeks, at least the person has to undergo exercise program for at least 8 weeks to have a lower HbA1c values by 1%. By 1%, even this 1% reduction in diabetes will increase the life expectancy for at least 10 years. That is the recommendation given by ACSM and even the American Diabetic Association. These people are saying at least 8 weeks of exercise will lower the blood sugar levels by 1%, which increases the lifespan by 10 years, for 10 years. Even people who are going for weight loss, even 5 to 10% of body weight will make a lot of difference. Even not, it not only increases the blood glucose levels, it also happens the change in the lipid profiles, also improves the insulin sensitivity, also controls the blood pressure values. So if So how to so if you know that the person is having diabetic complications, associated complications, then how, what to do? If you are having a diabetic complications, first go with the exercise stress test. Then don't consider diabetes as a barrier to exercise, so counseling have to be given to the patient. So most of the Indian population, especially women, they find it as a barrier, so they take that privilege not to exercise. So proper counseling and proper knowledge have to be given about the diabetes, and how exercise would be causing benefit to those people. And moderate lifestyle activities are safe. Some activities may need to be modified. So according to American diabetic recommendations, if the diabetic population is having associated risk factors, then you have to modify the exercise protocol. Here it goes. So, if the diabetic person is having severe peripheral neuropathy, then encourage non-weight bearing exercise such as swimming, cycling, or arm exercises. But when giving upper body exercise, still have to be very careful, because upper body exercises causes increase in the blood pressure when compared to the lower body exercise. In case of, if the person is having autonomic neuropathy, then because of association of these people to high cardiovascular disease risk, undergo compulsory cardiac evaluation prior to the exercise program. And then if found suitable, then he can go with the aerobic activities and moderate intensity resisted exercises also. If the person is having microalbuminuria or nephropathy, then no specific restrictions for them. They can go with the exercise, especially there is no they can go with the aerobic sort of exercises. Then retinopathy, then avoid vigorous aerobic or resisted exercises. In case the person is having hyperglycemia and ketosis is present, exercise should be avoided. Usually, no need to postpone exercise for hyperglycemia alone. If the person is having only hyperglycemia with no ketones, he can go with exercise. If ketosis is present, he should avoid exercises. In case hypoglycemia, not frequently seen in these people, if they are not on insulin, if glucose levels are coming down to grade less than 100 per mg per dl, take immediately 15 to 20 grams of carbohydrates. That is why, especially type 1 diabetic people, these people are more prone for hypoglycemia. When if they go with exercise, their blood sugar levels may drastically fall, because they are injecting insulin. So it may fall below dangerous value. That is why always they have to carry a sugar packet or a sugar candy with them. And if they found any symptoms like giddiness or a decrease in the blood pressure, then you have to take 15 to 20 grams of carbohydrates to increase the blood sugar levels. So these are the different articles where they have suggested. We are just going according to evidence based, compared with either aerobic or either assisted exercises alone. Combined exercises showed more improvement in HbA1c values. That means aerobic as well as resisted exercises should be incorporated to have more gains in the blood sugar values. Even there is an another article. This is the meta-analysis studies I'm showing. That means systematic reviews and meta-analysis studies only have taken. Here there is another meta-analysis study in 2018, where they said is resisted and aerobic exercises are both recommended as an effective treatment uh, exercises in the management of type 2 diabetic patients, especially for elderly patients. Moreover, 2 to 3 times per week, moderate to high intensity of combined aerobic and resisted exercises are suitable to be conducted for type 2 diabetes populations. So it is, we can give safe, but remember, always under the supervision, we have to give the exercise program. This is another study done in 2019, where a composite score of coronary vascular disease risk factors indicated a greater reduction with combination training compared to the control group. In conclusion, individuals at an increased risk for coronary vascular disease as little as 8 weeks of combined training may provide more comprehensive CBD benefits compared to aerobic or resisted training alone. So we can, based on all these studies, we can nicely incorporate supervised aerobic as well as resisted exercises in the management of type 2 diabetic population. So we have seen got all the exercise program that we can give for type 2 diabetes, but we are giving all this, but what is actually happening when we give with exercise? What is happening physiologically? What is happening when you exercise? That we will see enough. So first thing is there is an increase in the glucose uptake and glucose utilization. How? In diabetes, if you see, there is an increase in the insulin resistance and decrease in the glutamine 4. As I told you, glutamine 4 is the glucose transmitter, glucose transporter. It promotes glucose. Once insulin is released, it stimulates the glutamine 4, it promotes glucose into the cell. But in diabetic population, this is impaired. The glutamine 4 is impaired because of the leading to mitochondrial dysfunction. As we all know, mitochondria is the powerhouse of the cell. If there is an alteration in the mitochondrial function, that means the fuel for our cells is altered, that the person cannot withstand, he has low energy values, he cannot exercise, or he cannot withstand even his daily activities because of the decrease in this mitochondrial alteration of this mitochondrial function. Why? Because this PPAR, that is peroxisome proliferator activated receptor, this is the main biomarker of the mitochondrial function that is altered or decreased in this diabetic population. Not only diabetes, these values are decreased even in obese people. They are decreased in the diabetic population. These are decreased in the renal, if the patient is having renal problems or coronary vascular disease. So, but where are these risk factors from? These are from the diabetes. Where from the diabetes is coming? From mainly from the central adiposity, especially. The white adipose tissue is the main reason that is causing increase in the insulin resistance because of the pro-inflammatory cytokines. So with, if the person exercises, with exercise, the reversal mechanism happens. That means these PPR values increases, the glutamine 4 increases, then there is a decrease in the insulin resistance. Now, then the blood glucose level starts decreasing, then the person glucose will be under control. That then the diabetes always will be under control. Next is improvement of the insulin sensitivity. So we all know that there is an increase in the insulin resistance in diabetes. So with physical activity, there is an decrease in the pro-inflammatory cytokines and increase in the anti-inflammatory cytokines. Pro-inflammatory cytokines means IL-6, IL-1, the resistin. These are all the CRF. These are all the pro-inflammatory cytokines. Anti-inflammatory cytokines means adiponectin, main adiponectin values. So with physical activity, the adiponectin values increases and there is a decrease in the pro-inflammatory cytokines, causes decrease in the inflammation, and once there is a decrease in the inflammation, then the oxidative stress to the cells decreases, causes an increase in the insulin sensitivity. Once there is an increase in the insulin sensitivity, then there is a decrease in the risk factors associated with the diabetes. And also see here, there is an increase in the endothelial function leading to increase in the cardiac, even the cardiac health also would be improved. Next, third one is protection of the pancreatic beta cells function. So here this with exercise there is relief of the glucotoxicity and lipotoxic. I told you the ketone bodies that there is an increase in the incomplete breakdown of fat in diabetic population. If there is an incomplete breakdown in fat, it leads to oxidative stress on the cell, leading to glucotoxicity and the lipotoxicity. This once if they are there, then the metabolism would be altered. So now with exercise, this glucotoxicity and lipotoxicity would decrease, thereby enhancing the lipid and fat and glucose uptake by the cell from the plasma. So there are decrease, so which causes decrease in the oxidative stress and decrease in the pancreatic inflammation. So thereby protecting the residual, means the left out pancreatic beta cells, and promote recover even the recovery of the already damaged beta cells function. Research states that at least 12 to 16 weeks of aerobic training improves the beta cell function and thereby promoting the glycemic control. Next effect is the increase of the lipid metabolism. Almost all the typed, if you see the number of, if you get more energy from fats, if you see more energy is released from the lipid metabolism, this lipid metabolism have to occur, otherwise then there would be an increase in the obesity. So with obesity the same thing, then insulin resistance, then leading to the diabetes and all. So even with exercise, there is an increase in the fat utilization. Type 2 diabetes mostly accompanies always with a bad lipid profile. Bad lipid profile means increase in the triglycerides, increase in the LDLs, that is the bad cholesterol, decrease in the HDLs, that is the good cholesterol. So once these, the bad lipid profile will lead to coronary vascular diseases. Next is it also leads to metabolic syndrome X. What is metabolic syndrome X? Increase in the blood pressure values, increase in the hypercholesterolemia, and also increase in the insulin resistance. These three constitutes the metabolic syndrome X. So with exercise, this metabolic, there is a reversal of these three, that is the cholesterol levels come down, then the blood pressure comes down, and the insulin resistance also comes down, causing improved blood lipid profile. Studies have proven that aerobic or resisted or combination of both causes increase in the secretion of catecholamines, especially the HSL, that is the hormone synthetase lipase. This HSL will promote lipid metabolism, that means the fat utilization by the cells. Next, alleviation of the systemic circulation. Once there is a decrease in the pro-inflammatory cytokines and increase in the anti-inflammatory cytokines, automatically there is a decrease in the inflammation. Once the inflammation decreases, then the blood glucose homeostasis is maintained, and even there is a decrease in the associated risk factors with the diabetes. So these are all we have seen, what are all the physiological factors that is leading to decrease in the blood glucose levels with exercise. Now, if you see, there is a recent, I just wanted to show you this because some of them might be students, they would be doing their research on these particular cytokines. So if they are going for any studies in diabetes, that is why I just thought I'll just talk about some latest cytokines that have been founded recently, in that is especially in 2012, and not many articles are there on these cytokines, and we can go with many studies now. And so these are the recent studies, especially concentrating on the adiponectin. As I told you, adiponectin is an important anti-inflammatory cytokine that is released from the muscle especially. It provides protection to the beta cells of the pancreas. Once adiponectin values are high in the body, it relieves the oxidative stress on the cell. And even the AMPK values. AMPK values means this AMPK, will promote, this will reduce the insulin resistance. That is the adenosine adenylate activated protein kinase that is mainly found in the muscle, that is mainly responsible for decreasing the insulin resistance. So once this increases, then the fat utilization or the glucose uptake by the cells increases. Moreover, this adiponectin will also decrease the inflammatory cytokines and also increase glucose uptake by the from the adipose tissue, thereby controlling the blood glucose levels. Next important myokine or cytokine released from the muscle is the irisin. This is of much interest now by all, even the dietitians or many physicians. They're concentrating on the irisin and exercise, and they found that the irisin, if you see, I told you especially in central obesity, there is an increase in the concentration of the white adipose tissue, which is the main reason for release of the inflammatory cytokines. So with irisin, with exercise, these irisin levels are increasing in the body. This irisin will convert the white adipose tissue into the brown adipose tissue. Once the brown adipose tissue, it is converted into brown adipose tissue, then comes the point of increase in the mitochondrial activity, or then comes the point of thermoregulation, then the energy expenditure is also increased, and then the glucose levels are also decreased. So irisin, if anyone wants to just try out, can do studies on irisin. It is the latest one. You can concentrate on irisin. So next interesting myokine released from the muscle from the bone, and especially from the bone and muscle, is osteokine, osteocalcin. So when you do exercise, because of the increase in the muscle contraction, there is a stimulation of osteocytes from the bone, which releases, these osteocytes release osteocalcin, causes increase in the insulin sensitivity, increase in the beta cells production, thereby causes decrease in the blood sugar levels. And moreover, it also causes increase in the glutamine 4 receptors, also insulin receptors which accept insulin, and then the glucose levels decreases. So that is why these three, especially the adiponectin, the irisin, and these osteokine, osteocalcin, are of now interesting for by the researchers. The ongoing research is going on. So these three are the main thing. So coming to the end, so always optimization of BMI and systematic condition is the most. There is a strong relationship between exercise and body immunity also. So exercise can promote a healthy immune system, leading to a decreased disease susceptibility and severity. Also, exercise promotes increased psychological status by an individual and promotes overall well-being of the individual. So coming to the summary, so diet, especially the Mediterranean diet, you have to go with the Mediterranean diet, means take lots of green vegetables, and you have a Mediterranean diet, okay, and take especially red meats and all. They should consume very less in their diet and take lots of vegetables and fruits into their diet, and along with that exercises and the medications prescribed by the physician. These three will help effective treatment towards the diabetes. At the end, I'm just putting one case study. Suppose if at all you wanted to give an exercise to a person, an obese, sedentary woman, her age is 55 years, weight 80 kgs, height is 152 centimeters, has type 2 diabetes for 6 years and BP under control with medications. How will you prescribe the diet and physical activity to reduce her weight as well as control her diabetes, hypertension, and targeting energy expenditure with excess of at least 1600 kilocalories per week? So how to do? Now just assume her target body weight of 60 kgs. She has to come down to 60 kgs. Then how will you prescribe your exercise? So BMI is weight by height. So 80 kgs by height square. Sorry. So BMI is weight by height square. That is, her BMI is 34.6 kg per meter square. That means obese. Walking 0.07 kilocalories per kg per minute. Energy cost of walking is her weight into 0.07, that is 80 into 0.07 is 5.6 kilocalories per minute she has to expend. So time needed to expend 1600 kilocalories per week. So how to calculate? 1600 divided by 5.6 kilocalories per minute, you are getting 285 minutes per week she has to walk per week, or 285 minutes either for 5 days or 7 days. That comes to approximately 57 minutes. So 57 minutes, that means approximately 1 hour per day. That likewise she has to do 5 days per week to expend 1600 kilocalories per week to meet, to come down from 80 kgs to 60 kgs. Her weight should come down. That is how you have to prescribe exercises, or how to calculate, how to measure the energy expenditure. But remember that at least the person have to spend greater than 1000 kilocalories per week to have health benefits. So that's all about the exercise prescription for type 2 diabetes. Thank you. Any questions? You're welcome.
Thank you, Dr. Aparna, for simplifying the diabetes mellitus with a simple language. You explained well how with the aerobic training and how with the resistance training we can reduce the HbA1c, and definitely we can control the type 2 diabetes. And definitely, but the thing is, ma'am, why because I find it out, you were saying the supervised program is better than the unsupervised program. So why in the physiotherapy clinics we are not seeing diabetic patients? Because there are no specialized diabetic clinics in India. Because
Yes,
everybody
sir.
thinks,
That is now. Yes, sir. That now the diabetic rehabilitation have to be incorporated by the physical therapists, because they are the best persons. They are called the exercise therapists. Especially the physios are called the exercise therapists. And I feel that every physio, in spite of the regular the rehabilitation that we go, they have to go with the diabetic rehabilitation or the hypertensive control programs, or likewise advanced or supervised programs would benefit the patients, as well as it would be credit for the physical therapists also.
ma'am, there is one more question is there.
So,
Always we discuss about what the American Diabetic Association is saying, what is the American Sports Sciences is saying. Why there is no studies are there on the Indian population?
yes,
Because there is not because you said of our morphology is different than the Western countries is there. So
yes,
something should be there. Okay,
yes.
more of the Indian studies on the Indian population. So is there anything
Definitely, sir. It needs
specially there?
lot of studies on the Indian. When I've been going through the studies on Indian population, there are not much research that is done on this in a diabetic population, especially in Indians. More of the studies are concentrated on Western population, and more guidelines, because if we go according to the meta-analysis or systematic reviews, and we go accordingly evidence-based, we go according to those reviews, and most of the reviews are on the Western population. I also feel personally that more review or more articles should be, or more research have to be done on the Indian diabetic population, because India stands next to in the second place of diabetes in the world. So the upcoming physios or the present physios have to be concentrating on the research in this pandemic, especially on this diabetes or obesity. That's what personally even I felt as an academician also.
But sometimes what happens, we go for the aerobic training,
Yeah.
and we should go for the cycling, biking, and swimming. but I find it out in the Indian culture. You would find there is less swimming pools are there, and there is no cycles are there. So,
Yes.
what you would be saying up in the walking part, how they would diagnose it, how much walking means, how they would regulate it this.
That's what, sir. At least 150 minutes per brisk walk, at least 40 to 60 minutes. There is a study, interesting study. At least 40 minutes of brisk walk using a proper walking shoe daily for 1 week would keep the 40 minutes or 20, at least 20 minutes of brisk walk would keep the insulin active for 12 hours. Just imagine if the person walks in the morning and evening 20 minutes, then the insulin sensitivity would be so increased that there would be reduction in diabetes. So walking has that much benefit as that of swimming and cycling. We Indian population, especially women, we feel shy to swimming and all. There are certain constraints, but walking is not at all a constraint for anybody, and it is not even it is not even costly. And that we have to train, especially we have to bring awareness among the public that walking improves. 20 minutes of walking would improve the sugar, would improve the insulin for 12 hours. Just imagine that awareness have to be created by the healthcare workers, Alisa.
What about the exercise timing? At what time we should go for the exercise? Morning or in the evening? What would be
Most
the
probably mornings would be better because we would be exposed to vitamin D at the same time before, especially before 8 to 8:30 a.m. in the morning. If people are not convenient with that, then after 3 o'clock in the evening is the best suitable time to exercise. So,
Okay, ma'am? Thank you for your wonderful talk. Uh, I think all the physiotherapists and all the students would work for the diabetic population, and definitely we can find out the more of the diabetic clinics in India with the in
so
the supervision of physiotherapists. Thank you, ma'am. Thank you.
thank you, sir. Thank you for giving me this opportunity. Thank you so much, and nice meeting all of you, sir. Bye.
Thank you, ma'am.
Bye, sir. Thank you.